All right. Good afternoon, everyone. Welcome. This is Daniela Latanzi coming to you with another live podcast with a great guest speaker. And today we're going to talk about the red light revolution, game-changing therapy your clients are craving. Hope that all of you are doing well, and we are happy to have you here. And today you have a great speakers and treat. Okay, so to do complete justice, I need to definitely introduce properly this speaker because besides being a great friend of mine, but she have an awesome bio. So I want to do justice, tell you all about her. Okay, so Anne Dunev, so she is a graduate from Ohio State University with a Bachelor of Science in Health Sciences, naturopathic medicine degree training in herbal medicine, and also have a postdoctorate in applied clinical nutrition from the Southern California University of Health Science. Also training kinesiologist and training functional medicine. And Anne is, I mean, we know since a while.
Quite a while.
Quite a while. Anyway, but and she have her own practice and called Well Body Clinic, both in California and here in Florida, and also have been for many years and work in the area of improving the health, the well-being, and working in focusing on women's health, digestion, metabolic functions, and anti-aging. Wow, welcome.
Thank you, Daniela.
Yes.
Lovely to be here.
Yeah, great to have you here. Matter of fact, I don't know if you remember about it, but when I was in California, like kind of came see you, and you did like a treatment on my back with the red light therapy. Yeah. So, oh wow, I like this. Anyway, so today you're going to have a great podcast, and we're going to talk about red light therapy. And I know that in the news, like, it seems that they become more and more popular, but seems that everyone talk about red light therapy these days. But I also know that a lot of people, they don't know too much about it. Like still like a lot of, well, what is it, So I would like your help to kind of orient people, like, okay, first of all, how you came about it. Like you were telling me about through a professor in Bologna, of all places, Italy. For who doesn't know, University in Bologna is the oldest university on the planet, right? But anyway, so yeah, tell me how you got involved with red light in the first place.
Well, actually, it was socially. A friend of mine was telling me about a device that she was using, and the device came from this professor at University of Bologna. And so we had a little seminar with him, and he had a device that he was starting to bring to the United States for the face.
Oh.
Well, of course, I was very interested. And he showed me online some of the different devices that he was already using 20 years ago. He was really ahead, and he was an inventor. And so I learned exactly what red light was. So that gave me a scientific grounding in why you would use a light. I mean, it's not a red light bulb.
Yeah. Wow.
And since we have LED lights, those are perfect for creating different red light devices. And there's been an explosion, not only in popular use, but just in terms of the number of studies and the science behind red light, even though light therapy has been around really since Hippocrates.
Right.
Hippocrates, yeah, many years. So it really started with the Greeks, but Hippocrates started heliotherapy. So we've known that certain spectrums of sunlight were extremely helpful for recovery and for therapies. So then, of course, in the 1800s, they started taking people to sanitariums. It was very helpful for tuberculosis, which was pretty rampant in those days. And they would give people sunlight exposure, but we still didn't know much about the whole spectrum of light. And that is what is the important factor about why you would use a red light device therapeutically.
Right.
So there's, we know that sunlight varies from invisible light to various colors of light.
Correct.
But the particular spectrum of red light and near infrared light can be used to do all kinds of things. And we'll get into the number of uses and benefits.
Right. That's amazing. That's amazing. So, um, so if we going into more into the details on this, so starting with the basic, so what is that red light therapy, and why it is so much more than just a trendy wellness gadget? So, I mean, can you kind of go a little bit more into details on that?
Sure. Well, apparently what red light therapy has done by the studies is it will actually stimulate oxygen production in the mitochondria.
Wow.
And so every mitochondria, and many cells have multiple mitochondria, and they're the little engines that drive the cell and allow the cell to do whatever cellular function, whether it's an eye cell or a liver cell or a muscle cell. So every cell has to have a whole production cycle in order to create what's called ATP, and I won't go into the, what that stands for, in order to be the fuel for the cell. And so in order to function that way, it has to have oxygen. And so that's where red light, the cells have something called cytochromes, and those are able to bind to create more oxygen in the mitochondria.
Wow.
And so it's a really interesting thing, because you think plants, and we know that plants use sunlight to create energy and to actually create food. And so the cells do it just with the chlorophyll and the sunlight. But as humans, because we use other energy sources, but we still need light. We cannot live in caves. We cannot be, inside all the time. And when you think today's lifestyle, we are inside ever since, really since the pandemic, even more so. Why do people go to the gym? Because they don't want to go outside and exercise, or they don't have time, and it's easy. You can go to the gym at 9 o'clock at night when there is no sunlight.
Yeah.
So it's really something in terms of lifestyle medicine that we have to consider. If we get enough light in our lives, and I don't mean just artificial lights, then we are healthier, and that's been shown through many studies.
Wow, amazing. Well, that's definitely put things in a different perspective when it's covered in that way. Yes. Okay. So you talked about before about wavelength, and that there is, it's not just anything. So you say, well, it's not just to be on in front of lights. So what is about wavelength? Why this is important factor and critical to getting more from a clinical point of view? Why this is important because for other practitioners listening, just rather than simple, okay, these are nice things to do.
Well, this particular spectrum, which is 630 to 690 nanometers, it is in the spectrum of light that actually will germinate a seed. And so, if you garden and you use a seed, it's, an inch under the soil.
Yeah.
Well, that spectrum of light will penetrate and will cause the seed to germinate and to start to grow. And so, again, going back to the fact that we need certain spectrums of light ourselves, this is why you would use a red light device. And every time you stimulate the mitochondria, then you're going to have increased cellular function. Now, there's a couple things that occur at that point. One is the increased energy to that cell, but the other thing is something called hormesis. And hormesis is the good stress.
Oh, wow.
That's the stress that you want to have occur that helps the body to respond and to create some sort of renewal. And so that it does tend to stress the cell in just the right way. And so that's why you get all kinds of benefits. As I said, I started with skin. So you want collagen production and protein synthesis is one thing that does occur with red light according to the studies.
Nice.
So there's also near infrared, which is another spectrum up more in the 868, 90 nanometer. And so many red light devices also use near infrared. Now, near infrared is invisible to the naked eye.
Right.
So we can't see the near infrared when it's in that spectrum, but it penetrates even a little bit deeper. So there would be two different applications and two different functions. You wouldn't necessarily, sometimes you can use them interchangeably, but you wouldn't use near infrared on the face necessarily.
Right.
You would just use the red light spectrum. But those are the therapeutic spectrums that we're talking about, which are also considered low-level laser. And the discovery came out of laser discovery was in around 1967, and that actually will cut tissue. So that's why with surgery and eyes and different types of surgery, they can use a laser to cut tissue. But one of the doctors who was working on that kind of research with rodents found out that when he cut the intensity down to low level, which would be in the red light spectrum, that the rodent's skin would heal and their hair would grow back.
Wow.
And then NASA took that technology into space. And so when astronauts were in weightless conditions, they couldn't heal. If they got a cut for something that they were doing, or even a paper cut, it wouldn't heal. And so they were doing all kinds of experiments with different wavelengths for growing plants. And so they decided to go ahead and try some of the different spectrums on humans, and they found out that they could bring about more healing even in weightless conditions.
Wow. So like the astronaut can heal also in space.
Exactly. And we just had astronauts return from the space station when they got stuck there, if you recall. Well, before, when astronauts came back from space, they couldn't walk off the spacecraft. It's such an effect to be in weightless conditions. Now they use red light therapy to keep their bodies strong, because it also has application for exercise,
right,
and for muscle recovery.
Plus oxygen, as you
plus oxygenation to the mitochondria. So it's part of the space program.
Wow, there you go. Amazing. So cool. That's amazing. That's amazing information. Now, as you know, we people that are listening to us. So, by the way, if any of you listen this podcast in the future, a replay, well, we also have this podcast that can be seen recorded on YouTube. So, if you are watching this podcast on YouTube, please, join, subscribe, all this stuff is going to help us to get the information spread around and help the YouTube algorithm. So it'd be awesome. Little plug there. And one more plug, just please stay behind on this podcast, because I have here on this box a little surprise you would like to know about it, which we're going to talk about at the end. So now, the viewers, this talk is for practitioners, healthcare practitioners, wellness practitioners. We have a lot of nutritionists, lots of our clients that have done train in nutrition response testing. And so in talking more from that point of view, how you would go about it from a practical side of things, how you can go if you have a practitioners that have an existing practice, right? So how you would go about to integrate seamlessly into the practice red light therapy, so that they become, in addition to whatever else, a chiropractor, an acupuncturist, or an NRT practitioner would be doing.
Sure. Well, what I do in my practice is I have red light devices. And so when people come in and I advise it for all kinds of conditions, because if you think about the kind of quality supplements that we use and whatever modality that you're applying, then it's only going to enhance it.
Right.
So I would put somebody in a treatment room, and I've done a lot of work with acne, for example. And so if if you're treating acne, it's usually internal. And then you also do red light, you're going to get a much better result. I've had amazing results from
Right.
that sort of thing. Somebody who obviously it's sort of a no-brainer if you're a chiro nutritionist, because then you could use it for any part of the body. Even in one treatment, people will get some relief from joint pain and things like that. So it's of course very good, and
Right.
most of us see quite a bit of pain. And so you're talking about drugless pain therapy, which is pretty valuable,
Totally.
and could even maybe help prevent some of the oxytocin types of problems that we have if
Right.
people only knew. It works along some of the same pathways as some of the NSAIDs and the drugs like ibuprofen. But of course, there's a lot of problems with those. So you're actually, again, doing drugless therapy.
Right.
What I think that it works with almost any issue. I mean, if you had somebody who was having liver gallbladder problems, you could put it over the liver gallbladder area. If you have fertility, which I do a lot of, natural fertility, you could use the red light in the area. Now, the good thing is, because of cell signaling, even if you're only treating the outside of the body, then you could, the body will signal
You
some of the
stimulated
effect,
there.
right, to other cells in the body. People are using it for cognitive issues, which is another big area that we're running into, that we're seeing so much more of. So you could actually apply it to the forehead. It will go through bone. Now they're getting into some really fancy ways to do it, intranasal and things like that. But that's a little beyond the scope of most of us. But in other words, there's almost nobody that couldn't benefit from it. It actually seems to stimulate either stem cell production or improve stem cell therapy. So the stem cells are very sensitive in a positive way to red light. So anti-aging, a lot of people like it. A lot of people really would benefit even just from regular treatments which could be sold on a subscription basis.
Right.
To come in and do a red light treatment. I'm actually at the point now where I think that virtually everybody should be doing red light, because we aren't outdoors enough.
Right.
And getting this therapeutic dose of red light in our lives, in any part of the body, is going to be beneficial. And I think that we need to get the word out a lot more to our patients and to our colleagues, that there is a very easy kind of way to introduce it. And the great thing too, as a practitioner, is you can set it for a few minutes. The patient is fine. They're very comfortable. And
Then you can go
right. And you
teach
don't have
somebody
to
else.
have somebody there as an assistant or whatever doing something. The device does the job.
Correct. So basically, like, you can have also the front desk receptionist, for example, set it up or train the front desk receptionist to do it, or an assistant if somebody have an assistant.
Exactly. You can, because it will go through plastic wrap or a sleeve or something, you can use the same device with other patients. And so you don't even have to clean the device, depending on what kind of device you have.
Sure.
But I have at least 3 or 4 devices in my office right now of various kinds and various types, because it's and also different settings and such. So
Right. That's great. That's awesome. Now, I know that you're using a lot also standard process as a part of your nutrition program, like,
true.
so, and the same is a lot of our people listening. So for somebody that is they're doing a protocol and have maybe clients that are already on a protocol or on a nutritional protocol, how, if can they just add it on, or they need to finish that their nutritional protocol that are on complete, or how you would go about it on a scenario like that?
Well, again, I would just use it. It depends on what protocol that they're on and what you're trying to treat. But I don't think it would matter. You could introduce it at any time. I think it's only going to enhance. With standard process, we're using a lot of the protomorphogens, which are designed. And if you know how Royal Lee looked at cellular health, he really figured out autoimmunity before DNA and Watson and Crick had figured out the DNA double helix. So he was already speculating that there was something wrong in terms of how the cell was reproducing and how the RNA and DNA was transcripting. So red light is only going to enhance that. So I think that virtually any program would benefit. But I also think that if you look at the Warburg effect and the fact of cancer cells don't operate off of oxygen and off of the Krebs cycle that makes the ATP for the mitochondria. They operate off of sugar. So obviously, we're always trying to get people to understand the effect of sugar. And if they really did, we would sell a lot less candy bars. So as far as just a potential anti-cancer because of increasing the availability of oxygen to the mitochondria, I think that alone is a huge reason to get people to be using red light. I mean, with the cancer rates what they are today, I think we kind of need all the help we can get.
Sure.
I heard an interesting viewpoint recently, I think on another podcast, that when you look at the abundance of things on the planet that we need for survival, you're talking about water, air, you can think of light as another nutrient. So in a sense, you're adding a nutrient, something that supports life, to your patient's protocols.
It's true. That's very true, especially because with you're enhancing even more oxygen productions at the cellular basis. So
exactly,
that's amazing. Awesome. Thank you. Now, going to the next questions, going beyond the general wellness, right? I mean, we kind of touch upon, but is there some specific conditions or issue where you see red light therapy kind of shine? I mean, obviously, like you already explained, it kind of cover a lot of things, but is there like maybe some specific area where even more than anything else, it create like a dramatic effect or positive change on a client?
Sure. I already mentioned the acne treatment, and then also, wrinkles. I mean, we live in a very cosmetic world, so that's really important to some of us. But bruising and wound healing, you'll get a lot faster. So people recovering from a trauma or just, everyday or sports recovery, speeds it up dramatically. But, there's so many areas that it will actually improve. For example, there's another area that I wanted to talk about, and that's TBI. And again, we're seeing traumatic brain injury.
Oh, wow.
If you've ever been around somebody who's had TBI, it's pretty significant.
For who doesn't know,
I'm sorry. It's traumatic brain injury where there's been damage. And so there are, I mean, obviously not everybody's going to shave their head to be able to use the red light, but you could use it on the forehead. Here's another one that's very, very new, eyesight. So when you use, if you use a strong red light close to the face, I very often give eye cover, and obviously you'd have somebody close their eyes, but even with eyes closed, there is a benefit. So if you wanted to do some sort of facial treatment or forehead treatment, you could cover their eyes, but you could uncover the eyes for a few minutes. And there's been cases of improvement in cataracts and improvement in eyesight. So again, eyes are the only part of the brain that's outside the skull. And so So I'm sure that there even could be further benefits, but that's one area where you wouldn't do it for very long. Usually you'll do a treatment for 20, 30 minutes,
Yeah.
and a lot of the devices will turn themselves off at that point. And then also there's fat cell reduction. It actually seems to empty out fat cells. And so that's a spectrum of red light and near infrared light together, which many devices have. And there's been significant reduction, and that's validated through studies, up to 5 inches, particularly if there is, some amount of fat, like belly fat, that could be reduced. And so when you talk about metabolic syndrome, which we're seeing with a lot of people where they are gaining too much fat around the waist, which is a sign of a heart risk, could even be a sign of fatty liver, then this is a way to help people. And again, men and women who isn't looking to, get treatment in that area. There's actually been studies that have shown that it lengthens telomeres. And so again, this is especially in the biohacking world and such, this is an anti-aging regenerative medicine. This is a big deal now. If you can have something that actually will show to lengthen the telomere, and the telomeres are things in the cell that are signs of the health and the longevity of the cell. So we're trying to have healthy new cells be regenerated, but we also don't want too much in terms of the cell just dying off, apoptosis. There's also some evidence that there's things called senescent cells, and these are cells that they don't go away, but they just sit there as duds, so to speak.
Okay.
And so they take up room in an organ. Well, you don't want senescent cells. You want to move them out. If they're not going to be useful anymore, then they should go away. And again, I don't know if this is a new thing for human beings, or if this is, which is possible because we have a very toxic world.
Yeah.
But anytime you're going to improve cellular mechanism and such, and you're going to be contributing to detoxification,
Right.
because you want the cells to be able to detox through the cell membrane. So you're going to get more detoxification through using the red light and the near infrared light also. And there's very specific pathways for that to occur. If you lower prostaglandins, and then you also lower bringing cytokines. If there's an injury to the cell, you want some degree of inflammation to show up, and then you want it to calm down again. And the red light will contribute to that, so that you don't maintain that inflammation, which initially causes the pain and the fever and the swelling, which is good, but you want to get rid of that. And again, drugless therapy to help reduce that. And again, we saw that during COVID. We saw a lot of cytokine issues.
Yeah.
So I did have some patients use red light on their chest during COVID, for example, for that purpose. And with other, good natural therapies, I think a lot of people did well using going that direction.
Wow, fascinating. So basically, kind of to a degree, also can be used as an extra additional tools to speed up detox or recovery from detoxification, using as a almost like as a boost to make that happen.
Exactly. I mean, I know that many of us are seeing sicker patients since COVID. COVID seemed to really, do more than just cause a viral illness and then recede, which we've always seen with viruses in the past. But now it's been a bit of a game changer. And so I think that with the really good quality supplements that we have, but then you add something more, and we really have to talk about lifestyle medicine now.
Yeah.
We just can't get around it, because we're doing our own scientific experiment, and it's not necessarily going well. Americans are sicker than most other people on the planet. So this is something that we really need to get across to our patients, that they can't eat the, sad American diet. And they have to, start really getting smart about this. But this is a sort of painless way to get them to improve their health. It's another tool in their toolbox, because not too many of us can do all of it. We can't all do the smart things. But if you, sleep is so important. So I wouldn't use red light right before bed, but you could use it a couple hours before bedtime. I just sat through a whole podcast today on cortisol levels. And, you want early morning bright light, but you want darker light, dimmer light, and even red light in the evening hours to calm things down and lower cortisol levels. And of course, if you're on your phone, you get a lot of blue light. That's not good.
That's not good.
But then you wear your blue light blockers while you have your red light.
Yeah, that's right. We have that too. That's fascinating. Well, and thank you for all these informations. Now, just before we end off, one more quick question. Like, is there like I'm sure you have hundreds of cases that you work with, thousands from all the years, but is there like maybe a couple of success or things that from using red light therapy with some of your client that kind of stood up to you that you would like to share?
Sure. Well, I had one, I'm not a chiropractor, so I don't do adjusting, but I had somebody come in with a frozen shoulder. She'd already been to at least 3 chiropractors. They couldn't fix it. So when I checked them with NRT, I found out that they actually had a virus in their shoulder, and I gave her red light treatments. And within a couple days, she started to have some range of motion, and within a week, she had full range of motion on a frozen shoulder.
Wow.
So that's one example. I have heard that it can treat a tear in the rotator cuff. Now, I haven't had that happen myself, but a friend of mine who uses a lot of red light reported that it fixed his rotator cuff tear. I've seen people with knee pain. There's a lot of athletes who get knee pain, and a lot of times I find that cod liver oil, really helps. But you're also, you really want to keep the tendons, ligaments, and muscles around a knee strong enough to hold the knee. And so I've seen pain and swelling start to reduce in just one treatment, and then over a few treatments, they're back exercising again. I've seen some wound healing with it. Bones respond well also. And, occasionally you'll have somebody who isn't really healing that quickly, especially lower leg stuff. And so I've seen where some issues, just weren't healing well. And especially, we've got some older populations. And although I had one kid who wasn't healing either, but she was eating way too much candy and had a mouthful of cavities, and her broken tibia would not heal.
Wow.
And so, again, using red light in these situations, you're really targeting. I really think that we have to kind of tell the body what to do and target. And that's why the supplements that are so targeted make a difference. But then you add in the red light therapy, and you're really telling the body, okay, this is where you need to be paying attention.
Totally. Wow, that's fascinating again. All right, so we are kind of getting toward the end of it. I'm not sure if there is any specific questions from the chat. Let's see. Okay. Let's see. I don't see specific questions, but I mentioned for all of you like a little surprise at the end of our podcast. And the surprise is that, well, I want to let you know that we now have our own light therapy device that you can purchase through us, which I want to quickly show it to you. And also I want to have Anne comment about it because she knows this well. This is basically it's a red light therapy device that is super simple to use, and mostly, like you mentioned, is what's cool about it is the fact that this can be used for targeting area that you want to treat, and because is let's see here, I feel that one of those commercial of unboxing, a YouTube video of unboxing. So as you can see here, this is basically, it's not huge, but what's cool about it is the fact that you can basically um, put it on a shoulder or put it on whatever the area affected, like you were saying about the things on the head, right? Or into the knees. So you want to kind of comment a little bit about
Sure.
this product or this type of why something like this would be super useful?
Well, I like this type of product a lot, and I've used the other more rigid ones also, because you're getting the red light right up against the body. So
Right.
if you have another type of device and you're standing in front of it, it has to be really powerful to reach you and reach inside the body. This device does, you use it right up against the
You
skin.
can basically, is the person
Right.
need to be like skin, or can have a t-shirt, or how's that work?
No, it should be skin.
Okay.
It should be skin. That's why I say you can cover it with plastic wrap or use a sleeve on it.
Okay.
But it wraps around a knee. This one comes with a belt, and so you can put it on your back and hold it in place.
So as you can see, like this is a Velcro, so you can use it.
Yeah, so it helps to hold it in place. You can lay it over the face.
Okay.
And I mean, you could hold it up, but you can also lay down. It's very, very calming and relaxing.
Right.
This device also has several settings.
Right.
So it has
Right. This guy, right?
yeah,
Like,
it has a red light setting. It has a red and infrared together for fat, but which you would never want to use on your face, obviously.
yeah.
But for fat, it actually empties the fat cells. And then it has the near infrared, which penetrates further, which you could use for muscles and, different types of healing that you want, not just on the skin level.
Right.
And of course, the red light does penetrate about 2 inches by itself, but the infrared goes in a little bit deeper. And the other thing about this device is that it pulses, and so you can set it just to be a steady light stream, or you can make it pulse. And again, there actually are studies which talk about that pulsing does seem to improve the response of the cells.
Oh, wow.
So there've been some various talks about that, and some of the devices that don't pulse say, oh, that's not necessary, but I actually pulled a couple
Where is it?
studies that show it pulsing does matter.
That's great. That's great. So, and then, by the way, if any of you would like to have a copy of those study, we can definitely make it available to you. So, now, if John, if you can help me with the thing. So, quick few information. So you can purchase the device through our store. So here you have it, red light therapy. If you can scroll down, so it gave all the information. So you're welcome to check it out. The we will put yes, like there is also a link to our podcast. We have spent quite some time to give all the scientific information and all the data on why this is important. And I think having this along with other protocol you're doing is going to be a great asset, a great additions to boost anything you do. We have a special for you, and so you can purchase, like, so we have $50 discount. So usually, so this can be bought now at $3.99. So, you know, we want you to use it. And if you need to buy more than once, no problem. But also, we started with a limited stock, so it's going to be first come, first serve. But you know, we'll take care of you no matter what. So anyway, so that's the news, and the link is right on the here on the podcast. If you watch the replay, so the link is going to be in the replay somewhere, so you can check it. Or if not, you know, you're welcome to call in and we'll help you. All right. So anyway, so Anne, so it was great to see you again. So thank you for everything. These are amazing informations. And yeah, I mean, I hope that let's see. Yeah, somebody say Rhonda say yes. I would like to see the study. Yes, Rhonda, and obviously we'll definitely send it to you. And yeah, so with that, this is going to be a wrap. So anyway, so again, Anne, thank you.
My
That
pleasure. It
was
was a lot of
great.
fun.
So thank you for all of you. And we have new stuff that's going to come up very soon with new products and also new things that can help with your practice and bring about, you know, wellness and a safe solution to your clients. So again, thank you to spending time with us. And again, thank you, Anne. Okay, have a
Thank
great
you.
day.